Cardiac Catheterization Laboratory, Cath Lab, 6th floor, Infirmary building. The Cardiac Cath Lab is located on the 6th floor of the QEII Infirmary building. There are 4 cath rooms and 1 EP room. When you first arrive at the Cardiac Cath Lab, you will be assessed in the holding area before your procedure. The nursing staff will check your chart for blood results, check that your consent forms are signed, and make sure you fully understand your procedure. For procedures, you will be given a mild sedation to help relax you. To prevent delays, patients have a short wait in the holding area prior to procedures. Following your procedure, a cath lab staff or physician will remove the tube and apply pressure to the area. You will go back to your room by stretcher shortly after the tube is removed. During this time, a nurse will frequently check your pulse and blood pressure. Cardiac cath room. All cath rooms have a single plane X-ray table. Tables can be floor or ceiling mounted. Our newest cath room has a ceiling-mounted X-ray machine that swings around you while taking pictures of your coronary arteries. It also has a special feature to allow rotational angiography. The rotational arm allows the technicians and doctors to rapidly view the coronaries at the push of a button. There are many individuals involved in the success of your visit: doctors, nursing staff, hemodynamic technicians, and radiology staff. In the control room, behind the lead glass window, staff will monitor your heart rhythm and blood pressure on a computer screen while the procedure is performed. The nurse will monitor you closely and will be communicating information to the physician during your procedure. A tube will be put in an artery in your leg or arm to allow the injection of dye to outline the arteries of your heart. You may be booked for diagnostic cath procedures to help identify whether there is disease in the artery. Alternatively, you may be booked for a percutaneous coronary intervention, PCI, which helps treat the disease. During your PCI procedure, your physician will open the artery by placing a balloon or coronary stent in the artery. Some patients are booked for a diagnostic cath plus or minus PCI. How you are booked is based on many factors leading up to a diagnosis of heart disease. EP lab. A patient will go to the EP lab to have their heart rhythm assessed. You will be booked for an electrophysiology study or an EP ablation procedure. In the EP room, the physician identifies the rhythm that is causing the problem and treats the irregular rhythm to prevent it from coming back. The equipment is highly specialized, which helps physicians identify the pathways causing the irregular heartbeats. Specially skilled nursing staff will support you during your procedure. Viewing room. Once your procedure is completed, the images will be interpreted by the cardiologist and radiologist. The information is then passed on to your physician, who will share the results with you.